Welcome to another presentation of Under the Macroscope. Today, I want us to take a closer look at the costs of medical care in America. Have you ever really thought about what it costs to obtain quality health care? Not very many people do until they need it, because there are those of us who have some kind of coverage that eases the pain, no pun intended. We must, however, start paying attention to what is happening in the medical care industry. Just like so many other crucial items on our list of survival must-haves, quality, affordable health care has taken some serious hits, and these hits are not new. I was amazed at the attitude of so many people in Congress who fought so vehemently against President Obama's health plan. So many of the Obamacare opponents all but said they didn't care if poor people were dying for lack of quality health care. There have been and are likely to be more attempts to abolish Obamacare by the same dogs for the same reasons. Medical research has not produced so many of the outcomes that we so desperately need, but we still have to pay for it, believing and hoping that the miracle cures will soon come. I questioned a so-called medical care advocate many years ago when I attended a medical care forum that was being sponsored by the church that I was a member of. I asked her what she thought of the then rising costs for medical care in America. She replied, and I quote, "The cost of medical care in our country is an indication of how much we value human life." End quote. I was stunned, to say the least. My first thought was, tell that to the people who can't afford it. Do poor people's lives have no value? Apparently not much, then or now. That incident took place over 30 years ago, and the only change in that attitude, at least that I have seen, is that things have gotten increasingly worse. Hospitals, at least that's what they call themselves, are openly persecuting and prosecuting people who, quote, owe them money that they could not immediately pay upon their release from the hospital, whether the care that they received was adequate or not. I know adequacy is difficult to measure, but only a patient can tell you if the treatment they received in that hospital really helped them. But the hospital's attitude appears to be, whether we helped you or not, we want our money, our money. What can we do? The majority of these people don't choose to get sick. I know there are so many voluntary patients who do some very dumb and stupid things that send them to the hospital, but that is not the norm. At the risk of sounding like what many are calling a socialist, let me say that there is a better way to do medical care in America that will benefit everyone and not just a select few, without sacrificing quality. Those who cry socialism every time that statement is made are, more often than not, among the wealthy who control everything, including medical care, or they are tied inextricably to this group who fear that their financial profits are going to suffer. Remember, the healthcare industry is a booming business, to say the least, and the money makers are not going to relinquish even a small portion of their fortune without an ugly and gruesome battle. Why is this so? What happened to the original Hippocratic oath that was espoused by Hippocrates, the one who is considered to be the father of modern medicine. The oath proclaims, and I quote, "To hold him who taught me this art equally dear to me as my parents, to be a partner in life with him, and to fulfill his needs when required. I will use those dietary regimens that will benefit my patients according to my greatest ability and judgment, and will do no harm or injustice to them. Into whatever homes I go, I will enter with the benefit of the sick, avoiding any voluntary act of impropriety or corruption, including the seduction of women or men." End quote. I ask you, have we slithered away from the Hippocratic Oath to a foolish commitment to hypocrisy? We need only to look at the numbers of so-called doctors who are currently in prison for sinking to some unthinkable lows because they had convinced themselves that they were God and no one would notice and no one would care. Their professional medical practice insurance was not enough to cover them, simply because the Apostle Paul warned us in Colossians 3:25, "Whoever does wrong will receive for the wrong that he has done, and there is no respect of persons." When will we learn that God does not lie? Just another Mackian observation. Thanks for listening. Follow me on Facebook at Under the Macroscope. You may also follow me on YouTube at Mac McRae. Please subscribe and share, and if you wish, you can make a contribution of your choosing by using the QR code on the screen. You may also write to me at Mac McRae, P.O. Box 403, Pineville, North Carolina, 28134. See you next time, and remember, under the macroscope, we take a closer look.